What's going on, ladies and gentlemen? Today we're here with Dr.Chi. Now, I'm glad she's definitely come by and visit our show today because due to all the new developments we're having, we're seeing people come out in front of state houses and protest. We still have coronavirus, going on. We can definitely ask Dr.Chi what is her medical opinion about some of the things we're seeing is going on top of some of the guidelines that some of you may have issues with. So, Dr.Chi, thank you for joining us on the show today.
Thank you for having me. I'm ready to talk.
All right. So Dr.Chi, tell us a little bit, about yourself. I mean, because going through, medical school is definitely not an easy thing to do. And we don't have a lot of, Black doctors in the U.S. The numbers are low. So tell us a little bit about your story.
So my name is Shinyera, but a lot of people call me Dr.Chi for short. I have a Nigerian background, grew up mainly in the Florida area where I am now, and I'm currently practicing as a family medicine physician, as a hospitalist. So basically meaning that I work full-time in the hospital and I admit patients, discharge them. So in other words, yes, I am front lines of the COVID pandemic that's going on right now. And as far as representation goes, you are correct. There's not many of us Black doctors, and actually even less with Black female doctors. There's only 2% of us that represent Black doctors at all as a whole. So it has been quite an interesting experience with everything going on. And, you've seen on the news about the disparities and how Blacks are disproportionately affected than our white counterparts. So it's been a lot. It's just been a whole bunch going on. And I'm glad I'd be able to have a voice and speak about, what's going on and the issues that we're facing as a community, as a Black population, and what we can do to change it. I didn't expect this to be something that of top of discussion as a physician. And I went to med school, wanting to help people. Yes, but no one ever said anything about a pandemic. This is something that's new for all of us across the board. So I'm glad I'm actually blessed to have a voice and be able to spread positive news and as well as the truth, because, a lot of false news are going on out there too. So.
Well, it's definitely a few things I would like to ask you based off of those statements. First of all, you mentioned how many Black doctors are in the U.S.? Do you know the raw number to that?
I don't have the raw numbers, but I know it's like 5%.
And how many doctors are in the U.S., period, then?
Oh, those are numbers I'll have to look up. I don't know the actual numbers of, that's something that I can look up, but I know specifically as far as percentage goes, it's a very low percentage of African Americans in general.
So why do you think that we don't have Black doctors here? Well, what do you think the cause of that?
I mean, we can go back in time and have that. I mean, from the beginning where we were already shut out of the schools that didn't accept us, then we had to start our own type of schools to accept us. And we're very limited to the HBCUs and then the med schools. And then, the acceptance rates of Black Americans are low already. And then, it comes from the household and what they look around and what they grew up with. It's very rare to see a household or parents that are doctors or nurses and successful. And so when a Black American is growing up, if they don't have that, how can they become that? So it's very important that we have representation so they can see that this is possible. Yes, we may be few, but it is possible to break those unfortunate history and to make sure that we are represented around the country. So it's kind of hard. It's not like a black and white answer. It's very just one of those things that we have to overcome and make sure that we're representative and have a voice to let others know that we need you. We need you in these fields, and we're bigger than just what the news is telling you and what we see on CNN of just, limited sources of color. So it's kind of a whirlwind of an answer to know why.
So you mentioned about medical school and you guys wasn't trained for a pandemic. Why is that? That's interesting that you said that.
The last time this happened was in 1918. I don't think none of us were around to even think this is something that's going to happen again. And if it did happen again, we assume that it's controlled. With the Ebola, with H1N1, we think, oh, this is limited. This is not going to get that big. We can control it. We have a health system that, can manage this. But we're realizing that we are at fault. We are not prepared. funding has been it was shut down, or not enough was given out to the pandemic because people assume that this isn't a problem. And we just was I think we knew the definition of a pandemic and an epidemic, but to be prepared for this is something that it's just not something that we're used to or we thought would happen.
Right. So in the future, I mean, maybe you talk to people who, who has different, training schools or et cetera for nurses, doctors, et cetera, medical schools.
Mm-hmm.
Is this something that's going to get put in the curriculum now ever since COVID-19?
I think it should be something to add in there. There's a lot of different things that doctors just aren't trained to do or to know because there's so much information already. But I think that is something that they need to add to the curriculum because this is real. Like every day we're getting emails of updates of what we should do for a PPE, what we should have. I mean, now we need to start telling people in case a pandemic happens, make sure you have your N95 at home for yourself in case there is a shortage, things like that the US wasn't prepared for. Now we have to be prepared for ourselves because we never know what the government is going to give us or not give us or ration to us. So to protect ourselves as individuals, we may have to now make that initiative to protect our own, because again, we can't protect ourselves. We can't help others if we can't even protect ourselves.
Well, I'm not saying more so, you saying this. I'm just saying the chatter. There's more so folks on the chatter. Do a lot of healthcare professionals feel in a way betrayed? And the reason why I'm saying this because they don't have all the equipment and they're expected to work around people with a possibly deadly virus?
I will say in general speaking, I can say yes, some healthcare workers do feel like were not protected. Especially in different hotspots that have been overwhelmed, like New York City. They weren't expecting this, and they didn't know the shortages that they would be confronted with. And what came with that is working their employees and making sure that they have enough staff and with any cost. And that means, not getting the proper PPE and not making sure they have enough rest or sleep. And there's so much aspects that I think no one really prepared for, and that's that mental state. Like, are they even sane to continue treating these patients because they're so overwhelmed? And there's so many things that I guess retrospect, looking at it back, is that you didn't expect this to be such a overwhelming on people's mental and emotional state. This has been draining, and in some ways, I think some workers do feel like they've been undercut in some ways because nobody was prepared for this. So they kind of just took, they were the guinea pigs of this all. And it sucks, but that's the reality of what happened.
Okay, because, we also looking at, talk about, African Americans, and they talk about a disparity. But, you probably know that the history of this, a lot of African Americans don't trust the medical profession due to the wrong things they've done to us, like Tuskegee experiment and many other things they've done to us in the past. So what do you think that we can do as African Americans to maybe trust the medical profession a little more? Do you believe that maybe we need to seek out, doctors within the community? What do we need to do?
So it's hard to tell somebody who hasn't had trust in their PCP or the health system for decades to be like, hey, now you can trust us because we're different now. It's really hard to say that. I think it comes from a little bit higher ups to make that first move, to say, hey, we know that you may not have insurance, or hey, we know you can't afford this, but this is what we're going to do for you. We're going to provide you with this type of care. We're going to give you this type of access, and we're going to assure that you are taken care of. And from there, our African American community can reach back and say, okay, you're taking a first step. Let me see what I can do. And when they provide all those mechanisms and methods, now they can start educating us as Black Americans on what this disease is, what you need to do to take care of yourself, what type of food you need to eat. And then it can work both ways, because if they don't even know what they're doing wrong, how are they going to help themselves? So I think it starts from, it's a partnership. It's not just, hey, let's trust you now. It's what are you going to do to prove to me that I can even trust you to begin with? And yes, we see the disparities. We see the numbers. Blacks are dying more than the white people. Like, that's just fact. The numbers are early, but it's a fact that's been going on for years. And it's not something that is new. There's something that is expected. So we need to make that change. How do we make a change within the government to allow our minorities to have this access and to know that they are taken care of, not put to the side like they have been in years?
Well, I'm glad you mentioned that, but would it be safe to say, and I've kind of been at least different, levels in life so far. Would it be safe to say a big reason why, well, it's two of them, but would it be safe to say it goes back to economics?
Of course. Socioeconomic status is definitely
Okay, so how, for people who don't know, how does economics play on your actual health?
So for someone who cannot afford to buy the healthy foods, who are always going to the fast food restaurants, they're the ones most likely to be obese, to get cardiovascular disease, to get the diabetes. And from there, they have to go seek help to get medical attention, or they're always in the ER because either they have complications from these chronic conditions. So it just keeps going on from there. If you go to any community that has low income, you know what kind of stores are around. There's always a Popeyes, there's always a McDonald's. You don't see the healthy, so fresh type of restaurants, or, the type of, barely even see Chick-fil-A. You see the restaurants or type of food places that are cheaper and they have easier access to. And from there, it's a spiral. They don't have the vegetables laying out in a nice, pretty market, so they have access to it that they can afford. It's almost planted there because they know what they can reach. And so that is how your economic status plays a role into your health.
So basically what you're saying is, because we have Nathaniel Jordan, he comes on once a week, and he focuses on nutrition. That's what he focused on. So basically what you're saying is the majority of Black America's problem is diet.
That is a big problem. Yes.
Okay. So it's safe to say that we need to be focusing more on getting rid of, like you say, the fast foods and the fried foods, and even with this shutdown, more people have been cooking at home. Do you think that's been probably a lot better for our health, cooking at home? Because like you mentioned, all those places like that, a lot of times you can't even get to them now because they drive through, etc.
I mean, they're definitely open. Don't get it twisted. Those places are still open. But I think the real issue is not just having access to the bad foods, is not even knowing what is bad in the first place. So again, that goes back to education and knowing. You may be cooking at home, but you're also frying your chicken at home. So it's not just I can go to McDonald's. It's knowing what is appropriate to you. I have to educate my patients when they are on this, downhill slope for diabetes and cardiovascular disease. I have to tell them, you have to switch out your fried chicken for some baked chicken. If you're going to eat fish, make sure it's sauteed and put in the oven versus you putting it in a frying pan. So there's different mechanisms that they may not be educated on, or how bad this really is. They may think, oh, I'm eating at home, I'm okay. But that's not always the end all be all. It's knowing what is a protein, what is a carbohydrate, what is fats, and how much should I really be getting? Because if they know the proportions and what they should be feeding their body, they know how to better take care of themselves. You'll be surprised. The majority of people do not understand those macronutrients I just said. It's very important to understand, but a lot of them just don't understand it.
Right. So the question I have also, and many people have been asking me this question, so I asked you the question because you are a medical doctor. I've been asked, why is it that African Americans are suffering more with the coronavirus, but you go on the continent of Africa, they're not having the issues and problems. They have it there, yes, and people are dying there, yes, but it hasn't been how it's been affecting us here. Why is that?
That is a good question. And I wish I had the answer to it, but I can give my theory. So again, I'm Nigerian, so I know my people in Nigeria, and yes, there are some cases there, but it's not as widespread as it is here. If you do want to go back to the diet and just the education of what we're eating in comparison, the food is completely night and day. the food in Nigeria or in Africa, it is mainly home-based, more natural ingredients versus what we're putting in our bodies here in America. We have a higher rate of obesity, higher rate of diabetes, higher rate of all these other chronic conditions because of what we are feeding ourselves and how we're not taking care of ourselves. I'm not saying people in Africa aren't getting it. I'm saying that the people over here, when they do get it, it's because of already how bad their immune systems are from history of what they're already putting into their bodies and how their immune system has been fighting from everything else. And again, it could be the not seeking help from the healthcare provider because of the trust. So it's a lot of different things that we can keep pointing at, but there's not really one specific reason why we're more affected. It spread like wildfire here in America. It did not spread like wildfire in Africa. If it did, you may see those same numbers, but it hasn't spread as much.
Right. You know, I personally have a theory about why it's spreading in certain areas, why it's in South Africa a lot more than anywhere else. I have a theory, but I'm not going to go there in this interview.
I'm actually curious to hear your theory.
Well, certain people historically have carried more diseases than others historically. Mm-hmm. And you can let's look at where we had America. The Native Americans, they didn't have certain diseases here until certain people from Europe showed up with it and wiped a lot of them out through disease. They didn't really all killed off like that with wars. It was wiped out with disease. If you look at what brought the coronavirus to the continent of Africa, it wasn't Africans themselves with the coronavirus. Right. It's people from Italy and different other Europeans that actually came in and brought it there. The one brother in Liberia, because see, I got to talk to people all over the place. The one brother in the government that got it in Liberia and brought it back to Liberia, he went to Switzerland and got it over there. So that's what I'm saying. Certain people, you know, just like the one sister, I forgot her name in Ghana. She was talking about even tuberculosis wasn't even in the African continent. Right.
So these are facts. I definitely agree with this. These are facts. They're all brought in from other countries.
Right. So I just believe that certain people are more sickly than others. We're more exposed to others here in America versus on the continent. We can kind of look at how many different groups of people are around. Mm-hmm. And then, yes, diet. I agree with you because, you know, when I went to, you know, Ethiopia, Kenya, for instance, they don't eat like we eat. You know, they don't have the GM. Matter of fact, GMO is not even accepted in a lot of these African nations. Right. And they don't do the horrible processing of the food that we do here. So yes, that's why I want to ask questions like, what is the rate of high blood pressure, diabetes, heart disease, etc. Let's say in Nigeria versus the average city or the average, you know, place here in America? You have an idea? Because I was always curious about that.
I don't have the rate, but I will say, like people in Nigeria and other countries like that, it's very hard to get the numbers, the real numbers, because we don't have that type of health system that just has those numbers available. Like if you're sick, you're just called sick. If you die, you might die of malaria, or they may say heart attack. And it's never really a known cause of death or cause of illness until like something's really more apparent, and those numbers aren't really real. So it's really hard to compare. Things are just different over there. It's just different how care is managed and how things are documented. So there's the numbers. And they may, even go back to COVID, they may have more COVID. They're just not documenting it, or they don't know it's COVID because they don't have the testing to even test them. So you really never know, honestly. And that's just the facts, and that's just unfortunate, but it's true.
Well, let's talk about COVID. We're here in the United States. You know, a lot of people, you know, of course, I understand on business, we do need to open up, but I believe it needs to be done a certain way.
Absolutely.
But when you see all these people that's, you know, they run into the beach, like just immediately within 20 minutes after they say they can go to the beach, or you had all these protests. And I was asking this question, is it safe for those people to be doing that?
Oh my gosh. I cringed when I saw that video of just people just walking the beach. And I get the community and all of us, we're all anxious to get back to normal life, but just walking on the beach isn't a normal life. I mean, it feels good, but the measures still need to be taken. The numbers are still there. Like as much as we saying it's plateauing, doesn't mean that it's disappearing. It just means that it's still high. It's just staying consistently high. And so it's very uncomfortable just to see Americans just just being, I guess, careless because they're over it. And meanwhile, people are literally still dying. Like every day, hundreds of people are still dying. And I think we need to take that into consideration and not be selfish because we want to go to the beach and they want to, interact with people. I get it, but let's be patient. We must be patient. We want our freedom. We're spoiled. Americans are spoiled. I get it. We're spoiled. We want what we want. We get what we get, and we're going to keep fighting till we get it. But at the same time, we're putting lives in danger because you want to go out. You may get the illness and be asymptomatic without any symptoms, and then give it to your grandma. And then now what? And now she's in the hospital because you decided you wanted your freedom for that one day at the beach. So I really want to encourage everyone just to be patient and let the recommendations come as they come and take advantage of this situation of just kind of being alone. This is nothing to play with. Like, people are dying, and the protests, I really don't understand it. I think we're just used to having a right of speech and a right to talk and, express our feelings and how we feel. But there comes a point where you have to take other people's lives into consideration and just wait. Just be patient.
I'm with you on that, especially about, I feel this way. A lot of people, certain more than others, or I feel spoiled, like you said, spoiled brats. I want to get out of the house. I want to go to the beach. I want to listen, the beach is not going nowhere.
It's not.
I mean, unless they about to get rid of it sometime soon. I don't know. Y'all got information I don't know. But, from what I've been hearing, and maybe you heard the same thing, maybe around July and August, maybe things would get back to, normal, all the way, maybe. You get what I'm saying?
Right.
And would it be safe to say that since people been staying at home is the reason why the cases have been going down?
Exactly. I mean, that is why it's plateauing and slowly decreasing in numbers, because people are social distancing. They're staying at home. There's not much events to where it's easily spread. And so we're seeing less people coming to the hospital because they are not being in contact with anybody that could potentially have this virus. So I think if we just continue on this trend for just a little while, maybe another month, I think we should eventually start easing our way into a normal life. Easing, not just, okay, it's over, everybody get back to what you were. It's not going to be like that. I know people are losing jobs. I know people don't have their small businesses anymore. And there's people, I mean, I could even talk about people in Africa, the ones that literally they rely on the community for just to eat bread. They can't even do that because everything is locked down. Like, I know the desperation in people's minds and their families. I get it. But this is a sacrifice that we all as a whole have to do in order to get to the main goal. And that is to get back to our new normal. And it might be still wearing masks. It might be making sure you're washing your hands still every 10 minutes when you do something different. That might be what it just looks like from here on out for a while. So we have to get used to this new normal and kind of just understand it.
Now, the only thing that I, like I said, I don't like with the situation, even hearing you saying new normal, wearing masks everywhere. I'm like, listen, I understand in certain fields you should wear that, to protect yourself. I get it, but this your normal, and I've worked in the petrochemical industry, so I know about wearing full face respirators and everything. I know all about it. But when you get off of those jobs and you want to be, with your kids and your family, you don't want to be walking around with some freaking surgical mask. None of us are doctors, know.
Right. I get that. No, that makes sense.
Yeah, you got the kids at doing a little party and everybody got to wear a mask as you're outside. I mean, it's ridiculous. So I get why some people are saying, hey man, come on now. It's a bit much, but also at the same time, some people may have autoimmune disease, which make them more susceptible, or like you said, the pre-existing conditions a lot of African Americans have. That definitely could make us susceptible. So basically, you saying just within the ballpark, if you were the person in charge, you would say at least the month of May, and then you can go back to normal in June.
I think we'll start easing our way into new normal type of regiments, probably like mid-May for sure. I know that there's governors in each state saying May 1st, and that's fine. But my personal feelings are easing it into like, not just saying May 1st, everyone go run crazy. It's more like starting May 1st, we'll start, opening up a park And then, in the mid-May, we'll see how the numbers go. From there, we'll start opening up the beach, and we'll start opening up these type of restaurants, and, taking steps to see how it's going. And if you ever see at one point in mid-May or end of May, the numbers are still plateauing or they're starting going up, okay, we're retracting. We're going back to where we were in April. So I think this is just these are steps I think that need to be taken before we get back to where we want to be.
Okay, so your advice is just to, even though they may open everything up in your state, because it can happen, but what you're saying is, if you can, just hold off a little bit in the month of May, if you can.
Just ease it in there. That's my opinion. Ease it. Don't just everybody go have party. No, ease it in there. Let it evaluate, and then try looking at the graphs, looking at all the charts and the hospital visits and all that, and then one step at a time.
Yeah, because because I've had some people even in my comment section would say, well, this thing is this, and I want to ask you this question straight up. You working with it? Is the coronavirus a hoax?
I don't even want to entertain that question.
Well, no, I'm asking you seriously, because you're a medical doctor. You get to see it, so I'm asking you a question. I'm asking because this is what people are saying is ridiculous. But I know I'm asking you a ridiculous question, but I'm asking you seriously. Is it a hoax?
If it's a hoax, then you tell those families who lost their loved ones, the 40,000 people in America, just America, who have died. I need them to ask them that question and say, did they die of a hoax? Because then that's insulting.
What about the second thing? And this have been, I've seen this kind of been documented. Is there a directive that if you assume without testing a person has COVID and something happens to them, you could put it as a COVID diagnosis? Are they telling you that?
No, you can't do that unless you actually tested them and they tested positive. Then you can put that as diagnosis. You can't assume a diagnosis and put that down.
Okay, and if people are doing that, then they're practicing malpractice?
I won't answer that question.
Okay, let me rephrase it a certain way. It's something that's usually against the rules of the hospital and policy.
Yeah, usually. I mean, everyone's policy could be different. I'm just going from my experience. I personally would not write that down as a diagnosis or cause of death if I don't know for certain that was an actual diagnosis and positive test.
Okay. So, to make sure so even if they open it all back up, your recommendation, because they can open it up tomorrow. Let's say Texas is I'm in Texas, so they're slowly rolling it out now, right? Mm-hmm. So today people can go to the park as long as they got masks and no more than 5 people in the group. Friday, he talking about opening up all the retail stores that you have to have a curbside service or delivery service.
Okay.
So even though they're doing all that, right?
Mm-hmm.
Your recommendation to say just kind of hunker down just a little bit if you can in the month of May, June, see if you can maybe get back out. Would be safe to say?
That I would be safe to say. And I would still just stress that the people who are high risk, I would take the extra measures. Like if they are freeing up these areas for anyone to, go to the stores or go to restaurants, I would say if you're high risk, if you're in that age group from 50 to, and above and have the comorbidities, the high blood pressure, diabetes, I wouldn't follow those recommendations. I'll follow your own. I'll protect yourself. Still stay home. Still do what you have to do for as long as you can. And then slowly ease out once it's clear, until you see those numbers going down. You see that it is, we are pretty much in the clear. But for the people who are so anxious and they just have to go out and go to the beach and they're not high risk, that's your decision. But those who need to be protected, don't come home to them and infect them because you wanted to be free, honestly.
All right. So, Dr.Chi, tell people how they can, if they have any questions for you. Of course, like I said, I would love them to talk to you. How can they contact you?
Absolutely. You can contact me in various different ways. I'm very active on Instagram. So my Instagram is ask_Dr.Chi, DrChi. And then on my website as well, I have a contact area. You can contact me on my website at thedrchi.com. And those are mainly my main ways you can contact me. And on my page on Instagram, there's a link for my email, and I accept emails. And I like advice. I love opinions. And if you want to contact me for other avenues, I'm open to that as well. And then YouTube, of course, YouTube, Ask Dr. Chi as well.
Okay, now just one last thing, because some people may say, "Oh, okay, well, Dr.Chi, is she accepting patients, or she just at the hospital?" Because I don't want to be asked that question. Maybe you can answer that real quick.
I don't accept patients. I'm full-time in a hospital. I just admit people who need to be in the hospital. So no, sorry, I can't see you, but I would love your opinion on certain things, but I can't give direct medical advice because you're not my patient.
Okay, no, I was more so I wouldn't ask for medical advice. I was saying that more so because people may say, well, hey, she's a Black doctor,
Right.
So basically you work at the hospital, you're not in private practice or anything
Exactly.
like that. Okay. All right. So ladies and gentlemen, this is Dr. Chi. Make sure if you have any questions for her, to ask her any questions, then surely go to, we'll put her information in the pinned comment below. You can check that out. And you could ask whatever you would like to ask her, and she'll respond within her time that she can afford to respond. So Dr. Chi, we had a great conversation today, and I thank you very much for stopping by.
Thanks for having me. It was a pleasure to talk with you.